Welcome to our fourth episode of Antibiotic Answers, where we take your antibiotic questions and give short, guideline-based answers while focusing on using antibiotics appropriately and preventing resistance. This episode is about MRSA nasal PCR screening. The first question is, what is MRSA nasal PCR screening? It's a rapid screening test for Staphylococcus aureus. Samples are collected via a nasal cavity swab, which is not invasive and only takes a few seconds per nostril. The test also only takes about 1 hour to show results. Next, what is the screening used for? Currently, it is used as a tool to rule out MRSA in patients with pulmonary infections such as pneumonia. Studies are ongoing for use of the screening in other types of infections. The test has a high negative predictive value and a low positive predictive value. Accordingly, a negative result means that MRSA can be confidently ruled out, so anti-MRSA therapy can be discontinued or prevented from being initiated. A positive result means that it's likely not MRSA, but we can't rule it out, so you can consider continuing or starting anti-MRSA therapy. It is crucial to consider the clinical status of the patient and use clinical judgment when interpreting the results, especially with positive results which aren't as clear. So why is the screening important? It has some big advantages compared to traditional cultures. First, it's faster as results should be available within a day with that 1 hour turnaround time, while traditional cultures might take a few days. It's less invasive, being a quick nasal swab compared to traditional cultures, which can be difficult to collect. The screening is more sensitive, meaning it can detect bacteria more accurately and earlier than traditional cultures. And lastly, the screening is more effective at detecting MRSA in patients who have already received antibiotics. As a result of these advantages, anti-MRSA therapy can be discontinued sooner in patients unlikely to be infected. This helps to reduce overuse of antibiotics, which then reduces cost, drug-drug interactions, adverse effects, and decreases the development of antimicrobial resistance. For our next question, what is the impact of the screening? This slide shows 3 different studies, all involving patients with pneumonia specifically. The first article was a retrospective study that assessed the impact of implementing MRSA nasal screenings into their practice. Key findings include about a 2-day reduction of average duration of anti-MRSA therapy, as well as almost a 3-fold reduction in vancomycin serum levels and dose adjustment requirements after the implementation of the screenings. The second study was an observational study that compared those who did and did not get MRSA nasal screenings in the emergency department. This study found almost a 4-fold reduction in readmission rates for those who did receive the screening, and it also found that those who did not get screened often received greater than 1 dose of anti-MRSA therapy. The last study was similar to the first one. It was also a retrospective study that assessed the impact of implementing the screenings and found that the average duration of both vancomycin therapy and IV therapy was about 1 day shorter after implementing the screenings. All of these findings were statistically significant, and further studies will help to support these results, as well as examine use of the screening in other types of infections. For our last question, when should the screening be avoided? Unfortunately, the screening isn't appropriate for all patients and should be avoided or cautioned in certain situations. It should be avoided in patients who have a structural issue within the nasal cavity, such as an obstruction, bleeding, burns, ulcers, fractures, or open wounds. It should also be avoided in patients who have had recent MRSA decolonization from intranasal mupirocin. Caution should be used in cystic fibrosis and chronic bronchiectasis. Also use caution in critically ill or hemodynamically unstable patients, as there is limited evidence for them. And lastly, use caution in septic shock, febrile neutropenia, or other conditions in which there is a significant risk of morbidity and mortality if a delay in effective treatment were to occur. To recap, MRSA nasal PCR screening is a tool used to rule out MRSA and reduce anti-MRSA therapy in patients with pulmonary infections. The clinical status of all patients should be considered when interpreting results. Thank you for listening, and if you have a question you would like answered, please email it to emily.perry@ndsu.edu.